Infertility, problem of conception. After the completion of this presentation, the viewer should be able to describe the cause, frequency, and implications of infertility, outline the non-pharmacological methods used to treat female and male infertility, and to be able to compare and contrast the most common medications used to treat female and male infertility, including mechanisms of action and potential side effects. In general terms, infertility is the inability to conceive, although it also refers to a woman being unable to carry a pregnancy to full term. Keep in mind that infertility is completely natural for much of the menstrual cycle, with fertility peaking before and during ovulation. This webinar will focus on the unnatural causes of infertility in both genders, the reasons preventing couples from having babies that want to have babies. Infertility in North America and in many places in the world has increased since the 1980s, mostly from fecundity problems associated with aging, but also due to many environmental factors that we'll be discussing shortly. There are a number of definitions, formal and informal, in regards to infertility. The WHO, or World Health Organization, defines it as the inability to conceive a child after 2 years of regular sexual intercourse without contraception. In contrast, many American doctors, in particular reproductive endocrinologists, think that infertility treatment is appropriate for women under 35 who have not conceived after 12 months or 1 year of contraceptive-free intercourse, or for women over 35 years of age who have not conceived after 6 months of trying with their partner. In essence, the failure to conceive in women under the age of 35 isn't regarded with the same urgency as it is in those over 35. Also, there's primary infertility, which is infertility in a couple who have never had a child together, and also secondary infertility, which is a failure to conceive following a previous pregnancy amongst a couple. As just noted, the definition of infertility differs significantly around the world, so the incidence and prevalence statistics also range quite wildly. However, estimates suggest that worldwide between 3 and 7% of all couples or women have an unresolved problem with infertility. Specifically in the US, between 10 and 15% of couples are infertile, but only 1 to 2% of these couples are actually sterile. Women clearly become less fertile as they age due to the aging of their eggs, but for men, the aging impact on their fertility is not clear. In terms of gender specifics, about 1/3 of the issues involved with infertility are female-related, 1/3 related to the male, and the remaining 1/3 are either caused by both partners in some fashion or are of unknown origin. And many of these unknown origins are environmental causes. Here's a graphic depicting statistics for American couples who try to conceive for 1 year. At the top there we see for all couples, infertility occurs in at least 1 in 10 couples, or 10%. But as we get into specific age groups, those numbers change. For example, in the 30 to 34 category, actually 1 in 7 couples have issues with infertility. Between the ages of 35 and 39, that increases to 1 in 5, or 20%. And in the 40 to 44 years old category, it increases to 25% of couples, or 1 in 4. There are a number of general causes of infertility that affect both genders. For example, DNA damage harms ovocytes and sperm. Main causes of this include smoking. As a matter of fact, tobacco smokers are 60% more likely to be infertile compared to non-smokers. Radiation exposure can also damage the DNA, as does chemotherapy, accumulation of reactive oxygen species, also called free radicals, and even high fevers can damage the DNA, particularly in men. Genetic factors, such as a Robertsonian translocation in either partner, can cause recurrent spontaneous abortions or complete infertility. Health conditions are a major factor, and these can include diabetes, thyroid problems, adrenal disease, hypothalamic pituitary factors, cancer of the gonads, and sexually transmitted diseases or STDs, which I'll talk at a little bit more at length in a minute or two. Environmental factors are very significant, in my opinion at least. Some of the known chemicals or compounds that cause issues include glues, petroleum-based solvents, dry cleaning chemicals, silicones, formaldehyde, pesticides, bisphenols, and a variety of plastics and heavy metals, particularly lead and mercury. Dietary factors for infertility are often overlooked, and known issues include lots of trans fats in the diet, and a number of nutrient deficiencies, particularly zinc, selenium, vitamin D, and a variety of B vitamins. Food allergies can impact infertility, particularly to gluten and dairy products, and even caffeinated coffee reduces fertility, believe it or not. In general, for a woman to conceive, a number of things must happen. Number one, the sex organs must produce healthy eggs. And of course, her partner must produce sperm. Number two, intercourse must take place near the time of ovulation. And number three, the female hormones must be balanced. Female infertility can arise from either structural problems in the fallopian tubes or uterus, or problems releasing the ovocytes or eggs. Fallopian tube blockage, malformations, tumors in these areas, infections and STDs. Chlamydia is particularly damaging. Scar tissue from PID or various types of surgeries in that area. Endometriosis and cervical fibroids all cause issues, structural problems really, in either the fallopian tubes or uterus. A major cause of female infertility is the inability to ovulate. And this can be caused by malformation of the eggs, polycystic ovarian syndrome due to excess testosterone, for example, a lack of ovary maturity, typically caused by not enough FSH, or follicle stimulating hormone. Other factors in women that affect fertility include being underweight. A body mass index of less than 18.5, for example, invariably causes problems with fertility. On the other side of things, being morbidly obese causes problems. Older than 30 years, for example, chances of conceiving decrease by 3 to 5% per year after the age of 30. Here is a pie chart depicting the prevalence of infertility causes in American women. Here we can see in yellow and also pink at both 35% prevalence are ovulatory disorders and tubal obstruction. So together they count for roughly 70% of infertile problems. The purple section there at 20%, endometriosis. And in green, the final 10%, other causes or unexplained, such as idiopathic things or environmental causes, etc. Essentially, causes of male infertility involve either low semen quantity or quality, or sometimes both together. Low sperm count due to endocrine problems, nutritional deficiencies, illicit drugs, meds, tobacco use, radiation, infection, particularly malaria and mumps, both of which cause very high fevers. And even strenuous horseback riding or bicycling can reduce fertility in men. Hypogonadism, which is the maldevelopment of the testes, also increased by obesity. Medications that can affect fertility include those that affect spermatogenesis directly, such as a number of chemotherapy agents, anabolic steroids, cimetidine, and those that also decrease sperm motility, such as sulfasalazine and nitrofurantoin. Other causes that reduce fertility in men include malformed testicles, varicocele, which is essentially varicose veins of the testicles, hormonal imbalance, and ductal blockage. Here we have another pie chart looking at the prime causes of infertility as couples, really, for both genders. And in red there, the largest portion, 28%, is so-called unexplained, which really includes a lot of environmental factors there. Second most common at 21% is sperm production problems or sperm release problems. Then the next at 18% is ovulatory failure. Next at 14%, tubal damage in the female. Then at 9%, endometriosis or problems with the cervical mucus. And then coital problems, 5%, for example, erectile dysfunction, what have you. And then another are grouped together to account for the final 5%. A younger couple, say in their 20s, should try to conceive for at least 1 year before getting too concerned or consulting a specialist doctor about infertility. However, women older than 35 should consult a doctor after 6 months, as fertility testing does take some time, and age affects the treatments that are available. Female infertility tests include a regular gynecological exam, ovulation testing, which is essentially a blood test to measure hormone levels such as gonadotropin-releasing hormone, follicle-stimulating hormone, luteinizing hormone, estrogen, progesterone, hysterosalpingography, essentially an X-ray with contrast material to evaluate the uterus and fallopian tubes, ovarian reserve testing, which determines the quality and quantity of eggs, a sonohistogram, possibly pelvic MRI, and minimally invasive laparoscopy are helpful too with infertility testing. Male infertility tests include semen analysis. The normal volume should equal at least 25 milliliters. Assessment of normal sperm count should be between 40 and 300 million per milliliter. And certainly when it gets under 20 million per milliliter, there are serious problems. At least 50% of the sperm should be active as well and motile. And at least 30% of the sperm should be normal shaped. For men, there's also hormone testing, transrectal and scrotal ultrasound imaging, and of course genetic testing as well. Well, obviously the main symptom of infertility is not getting pregnant, but there are many other physical symptoms that can be red flags. For example, changes in menstrual cycle or ovulation, abnormal or irregular periods, either being heavier or much lighter bleeding, increased abdominal cramping, back pain, pelvic pain, and even headaches, hormonal-related symptoms, typically skin changes, flaky skin, for example, or too oily skin, acne, reduced libido, painful sex due to lack of secretions in the cervix, inappropriate hair growth, thinning of head hair, weight gain, mood fluctuations, of course. Even a milky white discharge from nipples unrelated to breastfeeding can be a red flag for infertility. Infertility symptoms in men are often vague, but can include changes in hair growth and sex drive also, pain, lumps or swelling in the testicles, small or overly firm testicles, and a shrinking penis, which is indicative of hormonal problems, and problems with erections and ejaculation, particularly noticeably less semen. Particularly for women, age is obviously a main risk factor, and fertility gradually declines with age and becomes more pronounced in mid to late 30s for women. Men over the age of 40 may be less fertile than younger men, but this is not well validated in studies. Tobacco and alcohol use reduces fertility in both sexes more or less equally. Smoking inhibits benefits of fertility treatment, by the way. Miscarriage is more common in smokers compared to non-smokers. Alcohol use reduces sperm count and motility in men. Weight issues, as previously noted. Obesity increases risk of infertility in both sexes, but being underweight, particularly for women who are anorexic and or bulimic, definitely impacts ovulation. Many environmental, home, and job hazards, both chemical and physical, that we've just touched on a few minutes ago. And STDs, 12 million cases each year in the US, and STDs can lead to pelvic inflammatory disorder and subsequent scarring. Adhesions, blocked fallopian tubes, ectopic pregnancy, and miscarriage can also occur with STDs. And some STDs can lead to epididymitis, which is inflamed ducts that carry the sperm within men. Obviously, it depends on the cause of infertility, but a variety of treatments may include counseling, fertility-enhancing medications, medical devices, minimally invasive treatments, and numerous natural remedies and supplements that we'll get into shortly. Common fertility meds include clomiphene citrate, bromocriptine, aromatase inhibitors, metformin, and various human hormone analogs, which can be fairly effective depending on the cause. In 2007, the FDA cleared the first medical conception device, actually a cervical cap, to aid with conception. This cap forces the semen up against the cervical os, and it's helpful for low sperm counts in males and low sperm motility, but also helpful for tilted cervixes in women. IUIs, in vitro fertilization, and other assisted reproductive technologies, generally known as ART, A-R-T, are also common treatments for infertility. Lifestyle changes include cardiovascular exercise, maintaining a healthy BMI, at least in the low to mid-20s, for example, controlling stress via yoga, tai chi, meditation, and a nutritious, well-balanced diet all impact fertility rates. Biofeedback can be helpful, and certainly quitting smoking, reducing alcohol and caffeine consumption, and avoiding all known toxins, both at home and the workplace, are also important. I'd recommend getting a water filter and not storing or cooking liquids or foods in plastic, particularly in the microwave, and buying simple and natural cleaning products as well. Physical treatments include acupuncture, chiropractic, massage, Reiki, but these are not very well studied in regards to infertility, but certainly some people report great success. There are a number of herbal remedies that have a long history of use for combating infertility, and we'll discuss those in a minute or two. And there's many other natural compounds, such as antioxidants, vitamin D, certain B vitamins, minerals such as zinc and selenium, and essential fatty acids are all helpful for promoting good fertility. There's not a lot, but there is some evidence to suggest that the ancient Chinese practice of acupuncture works in treating infertility. The needles stimulate key energy points believed to regulate physiological processes. A study published in Fertility and Sterility of 2002 found that adding acupuncture to in vitro fertilization increased the rates of pregnancies by 62%. It also increases production of endorphins, which are natural painkillers, but they also play roles in regulating menstruation and ovulation. Acupuncture also increases blood supply to the ovaries and testes. And really, acupuncture has no significant side effects and is relatively low cost. There are a number of herbal remedies that have been used for countless generations to promote fertility and or combat infertility. For example, Vitex agnus castus, also known as chasteberry, stimulates prolactin and luteinizing hormone secretion, and also balances progesterone and estrogen levels. It's particularly helpful for women who have a luteal phase defect, which is a short second half of cycle, or high prolactin levels. Doses range between 900 and 1,000 milligrams daily. Asparagus racemosus, also known as shatavari, is a species of a small asparagus grown in India. It is a traditional Ayurvedic remedy used as a general female reproductive aid and hormone balancer. The doses are between 1 to 2 grams daily, considered quite safe with no known side effects. Angelica sinensis, also known as dong quai root, relatively common Chinese remedy. This is very rich in iron, increases circulation to the uterus, tones and strengthens the uterus by regulating sex hormones. It can also balance the menstrual cycle. Up to 1 gram 3 times daily is recommended for dong quai. There are a number of other ones. I'll just highlight 3 more here. Tribulus terrestris, beneficial for both genders. In women, it increases serum FSH and estradiol. In men, primarily increasing testosterone. It also normalizes ovulation, increases sperm count and motility, and improves sexual desire or libido in both genders. So it's also known to combat erectile dysfunction. Doses range between 500 and 1,500 milligrams daily. B. propolis is an interesting thing. It's a resinous mixture of tree sap, buds, and leaves made by bees so they can seal the hives. An O3 study published in Fertility and Sterility showed that 60% of women with endometriosis-related infertility who took at least 500 milligrams twice daily for 9 months became pregnant, as opposed to just 20% in the placebo group. Evening primrose oil can benefit both genders, although it's primarily used by women. It supports a hormonal balance and cervical mucus production. It's high in essential fatty acids, and these are needed for making prostaglandins, which have a number of functions, but they're also known to reduce inflammation. Vitamin D, very important for this, of course. It's categorized as a vitamin with hormone-like properties, but in reality, it is a hormone with vitamin-like properties. It was really misclassified many years ago, and it's kind of stuck in that category. Anyways, the RDA is far too low, between 600 to 800 IU per day. The body can use and in fact needs and produces much more than that under ideal circumstances. There's research linking low levels of vitamin D with infertility and immune system problems. Vitamin D deficiency in mice has been shown to create infertility in a variety of studies. Vitamin D is also associated with sperm development and motility, so a lack of it impacts those areas. Vitamin D3 is the safest form. It is the one that our bodies produce when certain frequencies of summer sunshine hit our skin. Literally tens of thousands of IUs of D3 can be produced, within a half an hour of sun exposure. So supplementing even up to 40,000 IU daily is considered safe. Vitamin C and E, their recommended daily allowance is also far too low. Of course, people, all higher primates, I believe fruit bats and guinea pigs are really the only mammals that don't produce vitamin C. Your cat does, your dog does, many animals do, we don't. Both of these vitamins are strong antioxidants and able to destroy free radicals and stimulate immunity. Vitamin E increases fertility directly because it impacts sperm production. Vitamin C enhances sperm quality and protects it from DNA damage and also prevents it from clumping. Therefore, the sperm becomes more motile, can swim better. Vitamin C increases effectiveness of fertility drug clomiphene, by the way. In terms of dosage, 1 to 3 grams of vitamin C daily, no issues at all. For some people that really don't take vitamin C at all, taking 3 grams may produce a little bit of diarrhea or loose stool, but your body will quickly adapt to that. In terms of vitamin E, at least 600 IU, but keep in mind it does interact with vitamin K and influences blood clotting. Folate, also known as B9, keep in mind that it's called folic acid if it's a supplement, folate as it is in food naturally. And this B9 is known to prevent spina bifida in women who are pregnant, but it also impacts fertility. B9 along with B12 is necessary to produce the DNA and RNA of the egg and sperm, so it ensures the baby's genetic codes are intact. I'd recommend taking folate along with other B vitamins, particularly B6 and B12, because together they certainly improve sperm counts. And if you're taking this supplement known as the folic acid, doses should be at least 800 micrograms daily, particularly if you are pregnant. Zinc is probably the most studied nutrient in terms of fertility in both genders. It's an essential component of genetic material, and deficiency definitely leads to reduced fertility and increased risk of miscarriage. This has been shown in studies, particularly on other sorts of animals. Zinc is necessary to utilize reproductive hormones, particularly estrogen and progesterone. And it's also needed to make the outer layer and the tail of sperm. And lower zinc levels leads to low sperm counts. Selenium is a powerful antioxidant. It enhances immunity and also prevents chromosomal breakage. It's also needed to maximize sperm formation, and low levels in men definitely leads to low sperm counts. Excellent natural sources of selenium include Brazil nuts, many types of fish, turkey, and even certain types of mushrooms. Essential fatty acids such as omega-3 fats are also important, and these include ALA, EPA, and DHA. They have strong anti-inflammatory properties. They also aid in tissue repair. As noted earlier, they're needed to make prostaglandins, which also are a major component of semen. Too much omega-6, such as primrose oil, cancels the benefits of omega-3. North American diet is very high in omega-6s and not very high in omega-3s, so there is an imbalance in most people. Ratio should be 1:1 or no more than 3:1 in favor of omega-6 compared to omega-3, but a lot of Americans are at 20:1 or even higher ratios. EPA and DHA are found in fish oils, whereas ALA is in flaxseed, hemp, walnuts. Fish oil also prevents blood clotting, which can be beneficial to women who have clotting-related miscarriages. Dosages are typically 1 gram 2 to 4 times daily. Amino acids are also important. They are the building blocks of protein, and in particular in regards to infertility, I'm referring to arginine and carnitine. It turns out the heads of a sperm contain lots of arginine. The sperm use that amino acid as an energy source and a vasodilator. Arginine also helpful for erectile dysfunction, and in large doses it's quite similar in effect to Viagra, except minus the strange side effects. Carnitine is essential for sperm cell function, and good natural sources include most meats, fish, dairy products, wheat germ, many types of nuts and seeds. Fatty fish, such as salmon and herring, of course, are good sources of many minerals, amino acids, and of course omega-3 fatty acids. Lean turkey, chicken, or beef, good sources of the amino acids arginine and carnitine, and also a source of minerals. Nuts, particularly walnuts, and seeds, particularly pumpkin seeds, rich in a variety of fatty acids and minerals. Fresh raw fruit, such as berries or citrus fruit, very high in vitamin C and antioxidants. Raw vegetables, particularly leafy greens, not only high in various B vitamins, but also minerals and sometimes vitamin C. Wild yams contain a compound that mimics estrogen. Oysters, not only high in a number of minerals such as zinc and magnesium, but also a reasonably good source of protein and amino acids. Of course, they have a reputation of enhancing libido. Fresh dairy products, another good source of a variety of amino acids, healthy fats and minerals, and also whole grains, pretty much for the same reasons. Okay, now moving on to drug therapy, we have clomiphene citrate, brand names Clomid or Seraphine, and this drug essentially stimulates ovulation. It's often used by women with polycystic ovarian syndrome. It's essentially an anti-estrogen drug. It causes the hypothalamus and pituitary to release GnRH, FSH, and LH and stimulate the ovaries to produce eggs. It's usually used in combination with a variety of ART techniques, artificial insemination. It's taken orally and often the first choice for treating infertility due to the effectiveness and the established history of use, which is now well over 25 years. Typically, the starting dosage is 50 milligrams daily for 5 consecutive days, and ovulation usually occurs 7 days later. If not, then the dosage is increased, usually up to 150 milligrams daily. With ovulation, clomiphene should be discontinued within 6 months. So once it kickstarts that process, it's not meant to be used long term. About 60 to 80% of women will ovulate with this drug, and up to half will get pregnant. Side effects are generally pretty mild. Hot flashes, blurred vision, nausea, bloating, headache, reduced cervical mucus production, not uncommon. And there's a lower chance of multiple births compared to some of the injectable hormones that women can take to increase their fertility. Metformin, brand names Glucophage and maybe a few others, is known as a second-line drug compared to clomiphene. It's used on women who have insulin resistance and polycystic issues, suppresses glucose production in the liver, and it also lowers androgen levels. It improves ovulation and conception, especially when used in combination with clomiphene, and it's also not associated with any increased risks of multiple births, twins, triplets, etc. It's usually taken orally, and the daily max is just a little over 2,500 milligrams in 3 divided doses. Bromocriptine, brand names Parladel, Cycloset, treats hyperprolactinemia. And this drug is used for ovulation problems due to high levels of prolactin, which is the hormone responsible primarily for milk production. This drug lowers prolactin levels in the blood and stimulates ovulation. It's also used to reduce pituitary tumors, and these tumors can have negative impacts on ovulation. This drug can be taken orally or placed directly within the vagina. And another drug, cabergoline, brand name Dostinex, is a very similar drug compared to bromocriptine. There are many hormonal analogs that can be given to women that help increase fertility. For example, HMG, or human menopausal gonadotropin, brand names Repronex, Pergonal, Metrodin. This analog combines both FSH, follicle-stimulating hormone, and LH, or luteinizing hormone. It's an injectable used for women who don't ovulate due to pituitary problems, and it acts directly on ovaries to stimulate ovulation. There's also an FSH analog, brand names Gonal F, Fertinex, Follistim, and it works much like HMG. There's GnRH, gonadotropin releasing hormone analog, brand names Factral, Lutrapulse. This is rarely prescribed in the US, but it is in other parts of the world. It stimulates the release of FSH and LH from the pituitary gland. It's an injectable or nasal spray used for women who don't ovulate regularly. There's also an HCG analog, or human chorionic gonadotropin, brand names Pregnil, Novarel, Ovidrel, and this analog is usually used with other fertility drugs to trigger ovaries to release their eggs. In terms of these hormone analogs, the injections are usually started on 2nd or 3rd day of the cycle and given for 7 to 12 consecutive days. And these analogs can be combined with oral Clomid. Injectable hormones have a high rate of success. Typically up to 50% of the women get pregnant who are trying to. Some side effects though, risk of ovarian hyperstimulation, and of course multiple births such as twins, triplets, etc. Well, it's no secret that testosterone is the most important sex hormone for men. It's responsible for male secondary sexual characteristics, such as muscles and hair in certain places. And it also helps maintain sex drive, sperm production, and bone health. The pituitary gland controls production of testosterone by the testes in the scrotum. Low testosterone levels, which is typically under 300 nanograms per deciliter in the blood. The normal range is between 300 to 1,000 nanograms typically. Low levels lead to reduced libido, erectile difficulties, and low sperm count, which all negatively impact fertility. There are several ways to replace or increase testosterone levels. There are gel or patches that are applied to the skin, injections, tablets that stick to the gums of the mouth, and even pellets that can be inserted underneath the skin and then quickly dissolve. Really, the best method depends on how low your level is, also on preference, tolerance, perhaps you don't like injections, and also your budget. How much money are you willing to spend on this? Most serious risk with long-term use of testosterone is prostate cancer, but it's not considered a big risk. But there are some established cases. The risk is considered quite small. In terms of naturally increasing testosterone, I had mentioned there are some herbal remedies. Tribulus terrestris, for example, maybe even something called horny goat weed. But these herbs, of course, aren't well studied, not reliable methods of increasing testosterone. And probably in many cases, quite a bit of the herb, or at least extracts of the herbs, are needed to make an impact. IUI is generally referred to as artificial insemination, and it's a specially prepared sperm that's injected into the uterus, although sometimes also the cervix or fallopian tubes, and it essentially makes it a shorter trip for the sperm, and also the sperm themselves are, the better swimmers. They've been pre-selected. This is a popular treatment for men who have very low sperm counts or sperm that aren't motile, particularly swimming up to the fallopian tubes. It's also sometimes an option for women who have endometriosis, unreceptive cervical mucus, or cervical abnormalities. Interesting to note that this unreceptive cervical mucus is kind of an unusual, strange phenomena where a woman's mucus simply destroys the sperm from her partner. It's hard to say how this developed in evolutionary sense, but some women's mucus is just not friendly to some men's sperm. And for couples that are together, IUI is really one of the only options they have. The idea is to inject the sperm as close to the eggs as possible to get beyond this cervical mucus, which is either too acidic for the sperm or literally targets the sperm for destruction. Kind of a strange situation, but it exists. In terms of IUI, sometimes meds that stimulate ovulation are used before the procedures. And in general, the procedure is recommended for couples with unexplained infertility that can't be fixed with other methods, whether it be dietary changes, lifestyle changes, or drugs. It was once referred to many years ago as making test tube babies, and it essentially means fertilizing outside of the human body. IVF was first successful back in 1978 in England. It's the most effective type of assisted reproductive technology, collectively referred to as ART, which I mentioned earlier. And it involves stimulating and retrieving multiple mature eggs within the women, fertilizing them with sperm in a lab dish, preferably pre-selected sperm with the highest chances of success, and then implanting the embryos in the uterus between 3 to 5 days later. IVF is often used when fallopian tubes are blocked or when sperm counts are very low. This procedure tends to be complex and quite expensive. Typically about 5% of couples with complete infertility seek it out. About a 29% success of pregnancy and 22% rate of live birth. And since its introduction into the United States back in 1981, IVF and similar techniques have resulted in more than 200,000 babies, so-called test tube babies. Aside from standard IVF, there's a number of other ART techniques, such as zygote intrafallopian transfer, also known as ZIFT. It's similar to IVF, obviously, but embryo transfer to fallopian tubes instead of the uterus. There's also gamete intrafallopian transfer, known as GIFT, and it involves transferring eggs and sperm into fallopian tubes, so fertilization occurs in the woman's body, not outside of it. There's also intracytoplasmic sperm injection, or ICSI. This is where a single sperm is injected into a mature egg. Then the embryo is transferred to the uterus or fallopian tubes. These procedures sometimes involve the use of donor eggs, donor sperm, or previously frozen embryos. So it's not always the genetic material from the man and the woman in a relationship. Successful birth rates of ART range from 39% for women under the age of 35, but that falls to about 11% at best for women in their early 40s. And of course, like all ART techniques, the most common complication is multiple fetuses, twins, triplets, quadruplets, etc. As noted previously in the webinar, multiple pregnancy is the most common complication of infertility treatment. Keep in mind, the greater the number of fetuses inside of a woman, the higher the risk of premature delivery. The basic goal of infertility treatment is a single healthy pregnancy, and preventing multiple pregnancies should be discussed beforehand. Pursuing fetal reduction, which is essentially aborting the multiple fetuses and just leaving one viable one, is a major decision with ethical, emotional, and psychological consequences. And typically couples that find out that they're going to have twins, triplets, quadruplets, etc. often proceed with that, even though they might believe they can't afford to have so many children at the same time. Ovarian hyperstimulation syndrome is another issue. Injectable fertility drugs generally cause this, and it involves swollen and painful ovaries. Other more minor symptoms include abdominal pain, bloating, and nausea. Of course, bleeding and infection are complications that are related to any invasive procedure or any time you're injecting foreign material into the body. Premature delivery or low birth weight. The greatest risk factor for low birth weight is multiple fetus pregnancy, as I just mentioned. And of course, a baby that is born premature has a greater risk of dying and having a variety of complications, especially with their immune system and breathing. Birth defects are another complication. Babies conceived using IVF might be at increased risk of certain heart and digestive problems. Also, cleft lip or cleft palate are concerns with IVF or other ART techniques. Uterine problems such as endometrial polyps, a uterine septum, or intrauterine scar tissue can be treated with hysteroscopic surgery, which is essentially cutting away the scar tissue and opening up the canals for the passage of eggs and or sperm. Tubal cannulation is a procedure to help clear fallopian tube blockages specifically, and that's a common cause of infertility at about 25% of the time, if you recall the pie chart that I showed earlier in the webinar. Laparoscopy is the most common procedure used to diagnose and remove endometriosis. Sperm retrieval is a technique used to obtain sperm when ejaculation is a problem, and it's sometimes combined with electric or vibratory stimulation to help with ejaculation. And this is common particularly with men with spinal cord injuries that cannot get an erection or ejaculate by their own methods. And on the right here we have a diagram of the different problems that can occur, starting from the bottom left side: the polyps, polycystic ovaries, potential blockages of the uterine tube leading to the ovaries, a uterine septum or division there, a blockage, various adhesions that can occur, which is scar tissue, endometriosis, of course, fibroids, and also infection at the opening of the cervix. These are all possible causes of infertility, starting in women. Well, there are some options if a change in lifestyle or diet doesn't work, or if the various drugs, hormones, injections, or surgical techniques do not show results. There is always surrogacy, and this is for women with no eggs or unhealthy eggs, and a surrogate basically agrees to become pregnant using the man's sperm in a couple, and combined with the surrogate's egg, and then the surrogate gives up the baby for adoption by the man and the woman, or the parents, let's say, in today's politically correct world. Another option is gestational carrier, and this is primarily for women with healthy ovaries but no functional uterus. And this is where the woman uses her own egg, which is fertilized by the sperm from her partner, and then the embryo is placed inside the gestational carrier's uterus, and she carries it until full term, and then, of course, gives up the baby for adoption to the parents. And then, of course, there's outright adoption. Many children around the world from countries that are war-torn or what have you are certainly in need of loving and caring parents. And so couples in the Western world would really find no shortage of children in developing countries, third world countries, to adopt and give a good home to.